And the same questions, can we link our CPCH portfolio to GMC, which you, I think, already mentioned that we have to do the download and attach it.
Yes. All right. So shall we move forward?
Yes,
I think
please.
we have half an hour left, so let's complete it.
Okay. Yeah. All right. So let's go forward then. Okay. So this is what they need actually. So I will now go domain by domain. What competencies GMC and the Royal College are expecting, and what evidence you can provide. So I am telling you all this based on my personal experience, because now I have successful, so I can say that, but it is not limited to these, and they in depending on individual condition, individual cases, it may be more or less. So domain one, what the G is, is the professional values, and what the competencies you have to have is, you should apply knowledge of current legislation related to children and families. That's a very broad statement, and there's lots of competencies in the portfolio for that. And the second competency for domain one is practices independently in a safe manner. Now, how can you provide the evidence? How can you prove yourself in these? Here comes the main real thing. So you have to provide anonymized court reports and your witness statement in safeguarding cases. So now that's why I was mentioning clinical letters and redaction, because you have to redact the things anyway. So court reports for safeguarding, if you have attended a court, obviously, or a witness statement if you have been a witness in a safeguarding case. If you have not been to one, get yourself be involved in at least one case. So because all the trainees give evidence for these. Reflective notes relating to medical legal work. So you can, for one example, I can give that, for example, you are in the ward, or is it a safeguarding case or a self-harm case, or the patient is trying to kill himself or suicidal, and you have to involve police and all that to control the situation, or if the patient is aggressive, and you can write your notes in the reflection and make a developmental log that what did you learn during that, or other medical legal things, for example, sexual assault with a of an adult with a minor, or other way around, or so anything medical legal. Appraisals and revalidation if you are in UK. So appraisals are definitely, if you are working in UK, so appraisal is a part of your job plan in all, I think, every trust. So the appraisals are usually must. So appraisals are also very good piece of evidence, because your appraiser comment on each and everything, all domains of, you have from your CPDs, your quality improvement projects, patient safety, if you have been involved in any complaints or compliments or feedback. So appraisals are a very, very good piece of evidence. If you have the appraisal forms with you, that is well and good. If you don't have, go back to your appraisal manager in your trust, and you can ask them that I need my forms for the last 2, 3, 4 years, or whatever you have been working with. See, okay. So, oh yes, I was actually I opened my drive to show you my appraisal forms. Well, I'll open that later. Then reflective notes of independent practice. So if you are doing independent practice, for example, if you are doing independent clinics, again, the clinic letters now, they will be the part of your this evidence of this thing, independent practice, because you are working in clinic without any supervision. Certificate of good standing, that is self-explanatory. You can get that from all the institutions you have worked in. Evidence of learning and remediation of any deficiency. So again, you can write developmental log on that. For example, if you have learned something in the first attempt, you were not that good, and then you reflected on that, you did additional reading, learning, or explored different resources, internet, and then you did the remedy, and you overcome your deficiency. So provide evidence of that in a developmental log. CPD attendance records, again, this is very, as indicated by the name, just certificates of the courses relating to developing independent practice. For example, a leadership course. I think most of us have done a leadership course. If not, then try booking one. Now, domain two is a communication. Now, again, see the language. This is I have taken from the GMC. So the competencies they are asking for is that the candidate models and teaches effective active listening skills in consultation with children and young people. So you have to use active listening skills while consulting your patient, and you also have to teach that to your juniors. So the portfolio is not only for yourself, you can also use the evidence of assessing other doctors. So for example, you're assessing your juniors, F2s, trainees, ST1s and all that. So they send you tickets and you write some piece of advice to reflect on that. That is a very, very good piece of evidence for your independent practice, your communication and your training. Second thing, demonstrates to other. So please be very attentive to these all slides, because that makes the main thing of your application. Demonstrates to other how to manage an effective consultation, including communication and diagnosis, prognosis effective to children, young people, and families. Again, this thing is you can do by your clinic letter or referral letter, because in the clinic letter you write that I've explained to the parents that he has constipation. So I have given advice for healthy diet, fluid intake, daily exercise, regular toileting, and I'm also prescribed this medication, and I've referred them to the continence clinic or whatever, and I've signposted them for whatever resource. Leads MDTs and applies communication skills. So they are testing your communication. So you have to attend MDTs, and please try at least to lead 1 or 2 MDTs. So leading is not difficult. You just have to be a host and collaborate the communication between different professionals. So for example, the safeguarding meeting, you just have to sit on the computer, welcome everyone. So we are doing this strategy meeting today, and this is safeguarding nurse, this is GP, this is pediatric consultant, I am this. So you can, just you have to host, but that is a very strong piece of evidence. Supports and communicates effectively with families when the child is extremely unwell. So that is again when you are working in emergency and the patient is very sick or dying, or you are going to withhold your resuscitation attempts, and what kind of communication you do. Sorry, I'm just quite sunny here. Okay, and so you give evidence for that in a developmental log. So what evidence you can give for this table? You MSF, obviously you take multi-source feedback from all the colleagues and they write about your communication. Testimonial from parents and carers, if they give you any compliments, thank you cards, or feedback. Reflective notes on consultation, case histories, letters. So reflective notes on consultation are actually the clinical letters. Case histories, referral letters, MDT meeting notes. So all the MDT meetings you are attending or leading, they need a demonstrative active role. So see on this thing. So the minutes can be available with your secretary, and you can ask to write your name or your initials. Usually whenever they do a meeting, they have a list of attendees who are attending that. And then you have a discussion of correspondence. Okay. Level 3. So we'll stop after 3 domains, and then we'll take the questions, because this is getting complicated. So the competencies you need for domain 3, which are procedures, are advanced life support skills, which I'm sure all of you have. Undertakes the key procedure, again, peripheral cannula, lumbar puncture, airway, ETT, umbilical catheterization. All of you have that as well. And supervises and assesses junior staff undertaking clinical procedures. So when you are signing DOPS for your junior doctors, responds to and leads emergency situation and perform advanced life support. So APLS would be evidence for that, which you all have, I suppose. because that is compulsory in most of the trusts. So evidence you can provide for these are APLS, NLS, ePulse, DOPS, your logs, your skill logs, your evidence of simulation. Yeah, simulation and teaching is very so simulation usually happens in most of the trusts. So get yourself involved in one or two, and reflective practice on performing the procedures. For example, if you have done a lumbar puncture and you were unsuccessful and you tried again and it was again traumatic and you have to give antibiotic for 5 days, 7 days, or 14 days, so you reflect that I will be, you learned something and you will be more vigilant next time, and you learn some new skills and something like that. So I think we'll pause here and take some more questions. Is that okay? Or you want me to continue? Everyone there? Hello?
Continue.
Sorry, one
Yes.
question. Sorry.
Yeah.
Hello?
Yes.
Yeah. Can I give evidence from if I've seen a patient and independently, like during night on call, and it was like severe DKA or someone who's on OptiFlow or required intubation,
Yeah.
and there is a documentation like I am the one I have seen, I assessed, I called someone, and the decision was so and so and so, and my plan was so and so and so. So obviously this will be written in the progress note. Can I provide this as evidence after redacting the confidential data?
Yes, you can do that. You can provide that as evidence of a care assessment. Yeah, you can use that. But more independent practice will be a clinic letter, because that you are doing right from the start to the end without involving of any other else. But yeah, you can use that as a practice, as evidence as well, because in the night you were there and you have managed everything. If you have not taken any advice from a senior, if you did not require that, then you are independent. If you are working on advice of another person, then that is not an independent practice.
Okay, I got it. Thank you.
Okay.
So, Vikas, are we taking questions now? Because I can see a few hands up, or you're carrying on with the presentation.
My hands up. Can I go with my question, please?
Okay.
Yeah. So my question for Sadia, I saw in the chat box one of the attendees wrote that MTI fellowship is considered as eligibility criteria for non-CCT CESR. I think she wrote if she had MTI fellowship in pediatric endocrinology or neonatology or whatever, it can be eligibility criteria. I'm not sure if Sadia has evidence for this confirmation. Thank you.
So basically, I know someone who has come through MTI in neonates and then now doing a neonatology CESR. So I can't clearly say about endocrinology, but people who have come through MTI in neonates, and she's done a CESR in total 4 years. She did 2 years MTI, and then she moved up as a specialty doctor post in neonates, and then she completed her CESR, and she's a consultant in the same hospital where she came as an MTI.
Yeah. So that I don't think, although I have not read it, but I don't think it makes any difference what post you are working in. If you, as long as you can provide the evidence of competencies, then doesn't matter that is MTI or non-MTI or whatever. I don't think so. That is
so. Can I remind again that for non-CCT CESRs or subspecialty CESR, you must have overseas training experience and overseas postgraduate qualification. If you do not have that, MTI will not make you eligible for the non-CCT CESR or CESR in a subspecialty.
all right. Okay, next. Is that all?
Can I ask a question? Hi, my name is Farhana. My question is the community pediatrics competencies. We can go to the community pediatrics clinic and sit there and do our reflection, but we cannot produce any clinical letter. But because we're not doing those clinics.
No, you can do that. As I said, you can. Obviously you will need a support from the community pediatric consultant, but in your off time you can go and attend her or his clinic, and you offer can I do this letter? And most of the time, I think they would be happy to do that, because doing a letter is not an easy thing. So there will be at
Okay.
least some work less from his or her job. So I have done that. So I
Okay.
sure, obviously that will require the support from your whoever the consultant is, but I don't think it's a big problem.
Okay. Okay. Thank you.
Can I ask a quick question,
Ashutosh,
please?
Ashutosh, hands up, please.
Hi.
Sorry, guys, I'm going by time order. So whoever raised their hand first, I'm going through them first. So let me just say the name, and then you can pop in your question. So next hand up is from Ashutosh, if I'm pronouncing it
Hi.
correctly.
Yeah. Hi.
Thank you.
Thank you, Vikas. My name is Ashutosh. I've got a question regarding the feedback which we give to junior trainees or other junior doctors, as in SHO grades, or when you're working as a registrar. How do you get that evidence from them? Do you have to ask them that I have submitted, because I've given a lot of feedback to so many people until now, but I don't have any feedback?
This is the problem. Actually, I'm sure the evidence we have to, the competencies which we need to provide to get ourselves, acknowledged as competent. We all have that, but we don't keep the record of that. So if the junior doctor has sent you a request that will come in a portfolio, and if you are having a portfolio, it will be there forever. But if you don't have a portfolio, then in that case, it will be a problem.
Okay, because yeah, some would be RC CHP if they are pediatric trainees, but sometimes they are GP trainees, and some of them are other like foundation year doctors as well.
In that case, you
When
can.
you have done a mini kicks or a CPD for them, or a MSF kind of thing.
Yeah, then the surgeons operated on it laparoscopically, discovered macro diverticulum, so they had
Excuse me,
now
please,
he's been discharged
somebody is
today.
using his,
Unfortunately, so he's
can
at
you
home
mute?
now. He's opened his bowel since his operation. It's a bit of like diarrhea, a tiny bit of
Can
blood,
we
but
mute
then
all?
they know that's normal after an operation.
Can people mute
It's
themselves?
okay, not vomiting or anything like that. So he's not febrile at the moment either.
Jamil,
His mum said he's a bit lethargic, and he has
how
been
do I
before the
do that?
surgery.
I muted everyone. So can you unmute yourself, Dr. Vikas, now?
It's Dr. Sadia. All right. So coming back to that question, for if you have signed the some competencies for your assessment for your junior doctors, but you don't have the record of that, one option is that if you ask them, because that will stay in their portfolio forever, if they can give it to you. Other option is that from now onwards, whenever they send you request, for example, if a GP or F2 trainee with different portfolio, all they use 14 fish and Horus or whatever. So you can keep the screenshot of your assessment, and you can use that obviously after redaction of data. So that is also very, very important. That is not acceptable if you don't redact the assessment, the name and other details of your colleague when you are providing assessment. Next.
Okay, thank you so much. That was useful.
Okay, I can see two hands up. Are they history hands or they are new questions from Kulsum and Hannah? Okay, if there's the question been answered, can you please lower your hands? Thank you.
Okay, can we take a short break? I'll go for a drink and just 3 minutes, 3-4 minutes, if that's okay.
Yeah, perfect. That's fine. Have a drink, Vikas.
Let's take a break and then I'll be back soon. Okay, yes. All right. Sorry, it's quite warm here today. Okay, can we start again?
Yeah, we can start, but I think we've got only 15 minutes left.
That's fine. The meeting will continue. That is, and